Hi, everybody. This is Kara with Senior and Disability Services, and I want to welcome you to our CEH webinar today with our guest speaker. Today we have Mary Schneider, Diabetes Prevention and Control Program Manager from Public Health, and we're excited about that. As everybody knows, I want to just take a few minutes to go over some housekeeping. So everybody, I know everyone can see us and hear us and knows how to participate. Good morning, everybody. I know that most of us have been in my webinars before, but you have two things going on. You're attending on a device and you can see our webinar display. Right now you can see the first page of our PowerPoint, or the first slide of our PowerPoint. That is the big webinar display. You don't want to get rid of that. That is where we're going to actually do our, you'll view that PowerPoint there. We also have a control panel or control bar that you probably see on the top of that has a few controls. One of them is probably a little orange or red square with a white arrow where you can open up a place where you can text, and it might say text or chat above it, and it'll open up a chat field. Since you're attending in muted status, that means that you can hear us. But we are unable to hear you. It keeps our phone lines and our audio lines nice and clean. So the way you're going to participate is you're going to chat your questions. You're going to text them in to us, and we'll read them, and Mary will respond to them as we go. We'll certainly have plenty of time for that during the presentation and afterwards. Your audio, you're accessing either by telephone or by internet. Just through your device like you would any other audio if you're watching a movie or something like that. Either one is perfectly fine. We are recording our session today for placement on our YouTube channel, and I've also offered you a copy of the actual presentation. So if you look in your control panel for handouts, you might be able to download, I have a PDF file in there, so you might be able to download that. If you can't download it, don't worry. It just means that your particular device is not set up to download anything, or maybe not that file type. Don't worry, I can email it to you instead. All right, so if you can't download it, just give me a quick note in the chat and we'll have it sent to you, okay? If our internet connection breaks for whatever reason, the session's not over. Give us about 5 minutes to get connection back, and just we'll come right back into the same virtual room. Same thing for you. If your internet connection breaks, when you have internet again, just go back to your original email and come in using the link. Nobody will be able to tell, or we won't hear any chimes or noises or anything like that. You're free to come and go. Just know that in order to get credit to participate, you'll have to be here in the webinar and engage most of the time. Internet breaks sometimes, but it's pretty rare. And you'll have to engage with us a little bit by doing your chatting and asking questions and responding. Okay, so on your control bar, you should see a little hand in a circle or maybe in a square. I want to ask you to tap on that hand and raise your hand for me and let me know that you can hear me and that you can see. All right, go ahead and hit that little hand. We have 34 people in our session. Hit the little hand for me and raise your hand, and you can hear me and see me. That's how I know. All right, awesome. Thanks, everybody. Most of the little hands went up here. I'm going to go ahead and lower the hands because they kind of go up at different speeds, and I'm going to lower them. So you might see something that says instructor lowered hand or something like that. I'm not picking on you. I'm just doing what I say. Okay. If you see the little hand, just search for it. If you don't see the hand, don't worry. One of us wrote in, I don't see the hand. Don't worry, because you wrote to me, so I know you can hear me and see me because you're saying that you don't see it. So don't worry about it. You're good. Okay. If you want to practice the chat session, you can just write in and say good morning. If you can't see the first page of the PowerPoint, then give me a second to change my screen. First page of the PowerPoint should be visible to all within a couple of minutes here, or a minute, or a couple of seconds. You can write good morning to us. You can tell us how the weather is here. It's kind of gray here where we are. You can tell us how it is where you are. And good. Okay, awesome. Looks like everybody's pretty much set. Most of us are experienced at this, so we're good. All right. So that being all said, I want to go ahead and welcome our guest presenter, Mary Schneider, and we'll learn more about Diabetes Prevention and Control Program with the state of Alaska. So go right ahead.
All right, thanks, Kara. So like Kara said, my name is Mary Schneider. I work for the state. I'm the Diabetes Prevention and Control Program Manager within the section of Chronic Disease Prevention and Health Promotion. Full disclosure, I am not a clinical person. I'm not a nurse. I don't have clinical background, but I work in public health, and so I have the public health mindset, and I know specifically a lot about these diabetes prevention and diabetes management programs. And that's what I'm going to talk to you about today. So go ahead, Kara. Just to give a quick overview of what I'm going to cover today. So I'm going to briefly touch on diabetes and prediabetes trends and talk a little bit about what prediabetes is. And then I'm going to give an overview of these evidence-based programs that are available to those people with diabetes or prediabetes. And then talk about programs that are available in Alaska for those that have diabetes or prediabetes. And so this will take us through some slides. I borrowed these slides from the CDC, and what you're seeing here is the trend of diabetes prevalence across the US over time. And you'll notice that the colors are getting darker and darker, and that means that the diagnosis of diabetes is increasing over time. And Alaska's a little slower. I mean, you can see the south and southeast is kind of, they're hit the hardest, but you'll notice Alaska's getting darker over time as well. And a side note here is, this is, well, Alaska disappears in 2009. I'm not sure why, but this is just diabetes diagnosed prevalence. So there is, some people with diabetes don't know they have it. So those numbers wouldn't be reflected in this data here. This is just talking about diagnosed prevalence of diabetes. And you can advance. It gets stuck there.
Wow. That was pretty cool, though, to see how they depicted that throughout the nation, how it's increased and where it's increased. Okay, it's doing its thing.
I think there's one more.
One more, okay.
All right, so yeah, like I said, you can see that these rates are increasing, and we know that this is a big problem. So the CDC and other agencies have been working on addressing this. So you can advance. And so that was, nationwide data, but I think it's really nice to see that visual of it over time. It really tells a story there. But this graph here is showing Alaska-specific data. And what you're looking at is the percent of adults with diagnosed diabetes, and it's broken up by people with a disability versus people without a disability. And so you'll see that people with a disability have a much higher rate of diabetes here. And this is a 3-year average from 2015 to 2017. You can advance. And then this is just another way it's broken up. Here you're looking at breakdown by age. And so that top line, that teal one, that's representing people that are 65 and older. And again, you can see that population has a much higher prevalence of diabetes diagnosis. Mm-hmm. So the older population is more affected by diabetes. You can advance. So this is an issue not only because we care about the health of our people, but money speaks, right? So there's a financial burden as well. In 2016, the average cost of healthcare for a person with diabetes was $36,000 compared to $7,700 for a person without a chronic condition, and that's national data. But if we look at state-specific data, we did a study using 2016 data. And we found that more than $193 million was paid by Alaska Medicaid for people with diabetes in just 1 year, FY 2016. So we're spending a lot of money on this, and we want to know what we can do to help with this epidemic.
And please, this is Kara, please feel welcome to submit your questions as we go and as the thoughts come to your mind. We do have one question that came in Question says, do you think this has to do with income and how their food is prepared by others?
I mean, there's so many different factors. I think you might be able to look at the data broken down by income. I'm not positive. You can check out the Alaska IBIS data website and see if it's broken down by income. But I think there's so many different factors, and I think in general, Americans, have the way we eat is definitely impacting the rate of diabetes in the U.S. and in Alaska as well.
A lot of the people that we serve and our care coordinators serve are definitely dependent on others for food and hydration. So they're thinking about, our care coordinators are thinking about, other people preparing healthy meals and even meal delivery with our different agencies that do like home delivered meals or group congregate meals. Like, what's the content of that for somebody so dependent? They, somebody else is going to make that decision for them pretty much most of the time. And
I'll touch on that. One of the evidence-based programs I'll talk about is diabetes management programs, where they provide education on nutrition, and caretakers of people with diabetes can participate in those programs as well. So that might be something to keep in mind.
And a couple of comments says, our regulation says clients do have choice, of course. So if the homes are abiding that, then sometimes the clients still eat unhealthy if they are choosing unhealthy foods. Other thoughts, is there an agency standard? Like, the best agency standard I can think of from our regs is the licensing regs that govern like the food content, and they have to have menus, and it has to be balanced, and they have to offer meals and snacks. So yeah, there is a standard like that for our assisted living homes, basically.
And I would imagine, I mean, I don't know for sure, I don't know about all those regulations, but I would imagine if they are regulated, I would hope that they're using evidence-based, nutritional guidelines to develop those food plans.
Yeah, and then a comment says, we are talking about type 2 diabetes, correct?
So I'd say about 5% of people with diabetes have type 1 diabetes, and then there's a small percentage that has gestational diabetes, and then pretty much the rest of them are type 2 diabetes. And type 2 is the one that is typically influenced by lifestyle habits. And so the majority of people with diabetes have type 2, but this data includes people with type 1, and people with type 1 would be eligible for the diabetes management program that I'm going to get into as well.
Okay, awesome. Thanks, everybody, for your questions.
Yeah, good question. And so I really briefly want to touch on what is prediabetes, because some people don't know what it is, and honestly, there's healthcare providers out there that even don't know this. So prediabetes is when your blood sugar level is higher than normal, but not quite high enough yet to be diagnosed as type 2 diabetes. So you're kind of in the middle of that normal and not quite type 2 diabetes. And prediabetes increases your risk of developing type 2 diabetes, increases your risk of heart disease and stroke. And it doesn't happen overnight. You don't one day have normal blood sugar levels, and then the next day you wake and you have type 2 diabetes. This is something that develops over years and often goes undetected until, boom, somebody receives a type 2 diabetes diagnosis. So prediabetes is kind of in that middle range. That's what that is. And nationwide, the CDC estimates that there's 84.1 million adults that have prediabetes, and that equates to 1 out of 3 people, or 1 out of 3 adults. And that's a shocking number. I mean, when people hear that, they're like, holy cow. And then 9 out of 10 of those people that do have prediabetes don't even know they have it. So, I mean, how many people are on the call? 30 something. I mean, you can assume that 1 out of 3 of you have prediabetes, and you probably don't even know it. And so we want to spread the word and get this message out, and make sure that providers are screening for this so that you can take action before you develop type 2 diabetes. You can advance.
Yeah.
And so this is just a quick little data table on prediabetes diagnosis in Alaska, and this is over from 2008 to 2017. And you'll see for all Alaskans, they say only 10%, but these numbers, I don't want to spend a lot of time here because this is just counting people that have said that they have been given a prediabetes diagnosis by a healthcare provider. And like I said, 9 out of 10 people don't know it. So the true figure there we would expect to be much, much higher.
Mm.
You gonna advance?
Amazing. Comment says these are scary facts.
They are.
They are.
And so risk factors, and these are going to be the same risk factors for prediabetes or type 2 diabetes because they're not one and the same, but they, you know, prediabetes comes first and before type 2 diabetes. And so being overweight puts you at risk. Being 45 years or older increases your risk of developing these. Having a parent, brother, or a sister with type 2 diabetes, that'll increase your risk. If you're physically inactive, and that's, you know, less, not having moderate physical activity 3 times a week, that would qualify you as inactive, which is a lot of us, really. I mean, especially if we're working desk jobs, that's a lot of us. If you've ever had gestational diabetes or given birth to a baby who weighed more than 9 pounds, that puts you at risk. And there are some different races and ethnicities that seem to have higher rates of diabetes as well, and that includes African Americans, Hispanic Latinos, American Indians, Pacific Islanders, and some Asian Americans. So those folks are at higher risk of developing prediabetes or type 2 diabetes.
Mm-hmm.
You can advance, or is there questions?
There's a couple. There's a question about type 1 diabetes. Is it typically diagnosed in childhood? I know that it isn't always. A family member was recently diagnosed with type 1, and she's very healthy. Why do you suppose this happens?
Yeah, and you know, type 1 is different. That's something that you can't control. It's an autoimmune disease, and so type 1, these risk factors don't apply for people with type 1 diabetes. And typically, type 1 diabetes is diagnosed in younger folks, but that's not always the case. You know, I have a friend that was diagnosed as type 2 in her late 20s, and after trying to manage that for a year or two, she switched to a couple of doctors and then learned that she actually had a misdiagnosis, and she learned she was actually type 1. So, you know, there is no yes or no answer. I mean, typically, yes, type 1s are diagnosed early on in childhood or early, you know, teenage years, but that's not always the case.
Mm-hmm. And then just a comment, encourage us desk jockeys to be active. Yes.
Yes. So there are screening recommendations, and these come from the Standards of Medical Care in Diabetes produced by the American Diabetes Association, and they update these annually. So these are the most recent screening recommendations, and this is for adults. So because I didn't include the youth ones because I figured you guys are more working with adults. And so for adults, anyone over 45 years or older should be screened for diabetes or prediabetes. And anybody, even if they're not yet 45 years or older, anyone over 18 who is overweight or obese and has one or more of those additional risk factors. So if they're obese and are inactive, or if they're obese and have one of those race or ethnic groups, you would want to encourage those folks to get screened. And if their tests come back normal, then that's great, and they can go on for 3 years before getting retested. But you would want them to get retested every 3 years because things change.
Question says, when should you have an A1C test for diabetes?
And so that would be what one type of a screening, a blood test. When I say screening, I'm talking about screening from a provider. So that's getting a blood test done, and A1C is one of those types of blood tests. It is the most recommended type, and so that would apply to these screening recommendations. You'd want somebody to get an A1C test if they're 45 years or older, or if they're overweight and have one of those risk factors.
Mm-hmm. Question says, why are certain ethnicities and backgrounds at a higher risk of diabetes?
That you know, there is no clear-cut answer to that. It could be, you know, that their cultural diet is different, or just their cultures are different, and so their activities may be different. There is no clear-cut answer to that, so that's the best I could do.
Okay. We have more questions, but I'll wait on them.
Okay.
Come back to it.
So I just mentioned the screening recommendations to get a blood test by a healthcare provider, but you can also take this simple test that the CDC and American Diabetes Association has developed to see if you may be at risk. And it's a simple 7 questions asking, how old are you? Are you a man or a woman? If you're a woman, have you ever been diagnosed with gestational diabetes? Do you have a family member with diabetes? Have you ever been diagnosed with high blood pressure? Are you physically active? And what is your weight category? And so if you answer those 7 simple questions, and it tells you how to score yourself depending on each answer, and if your total score ends up being 5 or more, that means that you are at risk of developing, or maybe potentially having, prediabetes, which of course can develop into type 2 diabetes. So if you have a patient or a client that you know, can't easily make it to the doctor, or doesn't like to go to the doctor, or for whatever reason doesn't want to go get the blood test done to see if they are falling in that prediabetes or diabetes range, you can encourage them to take this simple test. You can take it online, or there's printed copies, and this would tell you if you're at risk or not. And if you just Googled prediabetes risk test, it would come right up. Okay, so I gave a brief overview of diabetes and prediabetes, and now I'm going to start getting into the evidence-based programs that are available to help these people. And so there are 2 different programs that I'm going to focus on today, and one is called Diabetes Self-Management Education and Support. They often use the acronym. I will try to avoid that because I know acronyms are not helpful.
Right.
And that program is for people with diabetes. So that's people with type 1, type 2, gestational diabetes, and caretakers of people with diabetes can participate in these programs. So that's the one program. And then there's also the National Diabetes Prevention Program, and this is for people with prediabetes. And this is a program that has standards and is managed by the CDC, and so there are eligibility requirements, and those are, you have to be 18 or older to participate. You have to have a BMI of at least 25 or greater, or for Asian Americans, that number is lower, it's 23 or greater. And you have to have a positive screening of prediabetes status, and that can be done through a blood test or that risk test that I just managed. So that's a lot, kind of. I'm going to go through each of these programs individually, but I just kind of wanted to give a brief overview of what the programs are and who they're for. So next slide. All right, so I'll start with the Diabetes Self-Management Education and Support. And again, this is for people that have a diagnosis of diabetes. And this program is going to help people prevent or delay diabetes complications. People with diabetes are at increased risk of other health complications like blindness, foot, toes, or leg amputations, kidney disease, heart disease, and stroke, just to name a few. And so this program is aimed at helping to prevent or delay those complications. And the goal is to help people make positive lifestyle changes, including healthier eating habits and increased physical activity. I know we all know we need to eat better and be more physically active, but this will really, some people don't know what healthy eating is, or they think they know, and so this is to provide them education on how they can do that. And also, it's aimed at helping them develop these problem-solving skills to self-manage their diabetes better. And so, yes, you can give people all the knowledge, and this is what you need to do, but to actually implement it in real life is difficult. And so this program wants to help people set goals. How can they achieve those goals and be realistic, set realistic goals. This education is provided by a healthcare team, and typically, oftentimes there's a registered dietitian or a registered nurse that is one of the primary primary healthcare providers on that team, and they help people, like I said, set, reach, and maintain these goals. And so when I'm talking about the diabetes self-management education and support programs, there's a lot of health clinics or healthcare organizations out there that have diabetes education, but not all of them are running, offering accredited or recognized programs. So I'm going to focus on those that are accredited through the American Association of Diabetes Educators or recognized through the American Diabetes Association. And that's because those, when they're accredited or recognized programs, that means that they have to follow set standards and meet standards that is ensuring that their program is effective. And so what does it really mean? What is you have a client that goes participates in a diabetes self-management education and support program. And so this kind of shows you exactly what that patient or client's experience really would be. So if you start at the top, you get a referral from a healthcare provider. So their provider refers them to this program, and so then they go and meet with one of the team members of the Diabetes Self-Management Education and Support Program, and that team member will assess them in 12 different content areas, and that's, what do they know about diabetes in general? What do they know about how often they should be checking their blood sugars? What do they know about nutrition and physical activity, and so on and so forth? So they'll sit down and have a conversation with the patient and determine what their current knowledge levels are. And then based on that, they're going to develop an education plan based on that patient's individual needs. If they only need help on, measuring their blood sugar levels, but they know everything else, I mean, there's no reason to provide the education on everything when it's not necessary. So they develop that plan, and then they provide the education to that patient, and then they evaluate the learning outcomes. So after the education is provided, they evaluate whether or not it's been effective. Does this person know more about those topics than they did before? And they'll also help the patient develop goals, and this could be like, make sure I include vegetables in my dinner 5 days a week. Something realistic, help them set goals. And then they'll follow up on those goals and ask them how they've done. And they'll also offer them, it says a DSMS plan, and that's a Diabetes Self-Management Support Plan. And so they want the provider should offer the patients options in their community that are available to help support this patient meet their goals and better manage their diabetes outside of the healthcare setting. And that could be, walking around the mall, or finding a friend to go take walks with after dinner or something. There's many different options, but that there are support options provided to the patient, and they help them choose something. And then they'll measure their outcomes after all this is said and done. So ideally, they would have had a blood sugar test at the beginning, and that's why the provider referred them. And so at the end of all of the education, they'll measure their outcomes, or their maybe A1C again, and see if there has been improvements. And then they'll send all of that information back to the referring provider so that the provider can follow up on the patient and continue to see how they're doing. Mm-hmm. So that's really what would happen for a patient that participates in this program. And it's not, it can happen over 2 different meetings, or it can happen over a year. It really depends on what the patient's needs are and how willing they are to participate.
So this is Kara. I have a couple questions. Mm-hmm. Just by listening to you talking about and describing this, I know our care coordinators are thinking about things like goals and outcomes because they make a care plan or service plan for people using home and community-based waiver supports. And some of the services are sort of educational in nature, like they help a person with daily life skills. Mm-hmm. So if I was helping somebody who experiences a disability, or a frail elder, or whoever has our waiver program, a person would go to their healthcare provider for this. Does every healthcare provider engage in this, or would they have to be ones that?
So yeah, like I said, there are many healthcare providers that may have diabetes education at their at their location. And I'm specifically talking about the ones that are through the accredited or recognized programs. That's not to say that these other diabetes education programs that are not recognized or accredited are bad and your patients or clients should not participate in them. I mean, something's better than nothing. And if we're their primary care provider, if their primary care provider doesn't offer an accredited program, and they don't want to change providers or go to a new location for that totally makes sense. I would still encourage them to participate in diabetes education if offered by their primary care provider.
Yeah, I think many of our folks will also, the ones we serve, will need help when they're at the doctor's office in terms of education, because they'll have some supports, who can certainly bolster these healthy practices and things like that. There are limitations to what our program staff can do. People may have a guardian who would be really active or not with this. So there's just a complete spectrum of involvement with the people we serve. But I think just to put a shell around it for us is that if a person engages in this program, accredited or perhaps another one if it's not accredited, it could certainly be brought into a plan, a support plan, and we could certainly have similar goals and interventions for people with elements of the support plan. It wouldn't be separated from the support plan itself. So if somebody was going to have a goal of making healthier choices to reduce their effective diabetes or for their prediabetes condition, we could have parts of that in a plan as long as that made sense for that person.
Absolutely. If you have a client that's participating in this program, it would be good for you to know that, and if you're already helping them develop goals and setting plans, there's not really you could totally integrate with these goals and these plans, because you don't need to have your patient having two totally separate things depending on who they're talking to. So it would be great to participate, be involved and ask them what their goals are and encourage them to follow through with them and follow up with them. You can, although it says that that's part of this diabetes self-management education and support cycle that the healthcare team is going to be doing, the more support and encouragement they get, the better. So definitely encourage and support any clients you have that are participating.
Okay. More questions, but we'll wait on it.
Okay.
Keep going.
So like I said, this is an evidence-based program. It's supported by the CDC and many others, and there's been many research studies looking at the efficacy of this program, and there are really good outcomes. So people that participate in this program are shown to have healthier lifestyle behaviors, improved hemoglobin A1C, improved control of blood pressure and cholesterol levels, higher rates of medication adherence, fewer or less severe diabetes-related complications, which then could lead to decreased healthcare costs and decreased time, hospital visits and time in the hospital. And diabetes can be very distressful for people. This is something that they're dealing with on a day-to-day basis, and it can lead to depression. And so participation in this program has shown to reduce that depression and distress for people with diabetes.
Great.
And so I know you guys probably may not be the ones referring, but I just wanted to kind of show this. This is when to refer to Diabetes Self-Management Education and Support, and this, is supported by the American Diabetes Association and others. And you can refer to these programs at an initial diagnosis of diabetes, during an annual assessment of their education and nutrition, or when any new complicating factors arise, or if there is a transition in care. And so that's a lot of different times, and what that's basically saying is there's no wrong time to refer to this program. Anybody with diabetes could benefit from this and refer at any time. Go ahead, next slide.
Yes, and it's also about the continuity of their care. especially for the people we serve, because we're just with people. Some people have services 24-hour, like they're residential and things like that, and important people come and go sometimes with those we serve. So it's helpful to have some kind of framework involving their healthcare provider around us.
And so these are the diabetes self-management education and support services that are currently available in Alaska. And like I said, I'm only highlighting those that are accredited or recognized. So we have quite a few in Anchorage, Alaska Regional, and Providence, and South Central have programs. YKHC in Bethel has programs. There's a couple in Fairbanks at Tanana Chiefs Conference and Tanana Valley Clinic. South Peninsula and Homer has one. Bartlett Regional and Juneau, and then Ketchikan Indian Community and Peace Health Ketchikan Medical Center in Ketchikan, and then also Central Peninsula Hospital in Soldotna. So these are where these services are offered, and like I said, there's many others that are providing diabetes education, and it's not to say their programs are not good. I would definitely, if that's the only option for your clients, definitely encourage them to participate, but these are the ones we know are following and meeting standards, so I highlight these.
Awesome. One quick relevant question. How long has this program been approved? It's the first time I've heard of an evidence-based practice for managing diabetes.
So the Diabetes Self-Management Education and Support Program, I want to say, I mean, many years. It's not only 5 years old or anything. The Diabetes Prevention Program I'll get into next is much newer, but this one, I don't want to say my guess, and it's totally wrong, but I would say, over 10 years it's been around. It's just, we just need to spread the word about it.
Gotcha.
And so that may look like a great list of programs available in Alaska, or maybe you're like, wow, that's all there is. And I just want to mention that in the U.S. in general, less than 5% of Medicare beneficiaries with diagnosed diabetes and almost 7% of privately insured individuals participate in these services. So they're underutilized in general. And this is for many reasons. There's a lack of access. People don't have these in their community, or there's a lack of coverage. Their health insurance doesn't cover it. Or insufficient provider referrals. Providers may not know that these programs are available, and so they're not referring. Or clients themselves can ask providers about these programs as well, but a lot of people don't know they exist. That kind of hits on the question that somebody just asked, like, I didn't know these programs were out there. And you're right, many people don't know they're out there. And so we want to get the message out there.
Have we measured any engagement of Medicaid beneficiaries through this?
Well, this service is not currently covered by Medicaid in the state. Medicare covers it, but it is not currently covered by Medicaid.
Gotcha.
So,
and folks ask, does Medicare cover these programs 100%?
I don't know if it's 100%. I'm not positive what the coverage.
Medicare info office could answer that question.
Yeah, sorry.
I have those guys too.
Yeah, I would reach out to them. Medicare is so complicated.
Yeah, Medicare info office. One person put no, it's not covered at 100%. And a lot of the folks we serve do have both Medicare and Medicaid.
Okay.
All right. So our audience would know, like per person. They could research per person. So it may be that your client has that and you don't know, but just check into it and see if your client has Medicare along with. Yes, Janae Larson, absolutely, at our Medicare information office. Call her. She's wonderful. She'll help you understand all things Medicare. Okay, go ahead.
So what is your role as a care coordinator in this? Where do you fit in? I would encourage you to help facilitate that referral. If you have patients with diabetes or clients with diabetes that you think could participate in these programs, encourage them to ask their provider if these programs are available where they're at. or encourage the providers, reach out to the providers and ask them to write a referral for their patients with diabetes. And a lot of times, coming from a provider means more than just somebody else encouraging them to participate. People trust their providers. And then check in with your clients and encourage them to follow through with their goals and ask them how they're doing. So that would be where you fit into this.
Okay. I can give information about the Medicare office in just a little bit. Maybe, Cassandra, you could look up their phone number. I don't want to undo my screen and look at everything else. If you could find their contact info and just shoot it to us, that would be super great. Thank you.
We're looking up Medicaid or Medicare. Who are we looking up? Medicaid?
Medicare info office with Janae. It's an SDS. It's on our SDS website. Medicare info office.
Okay.
Yeah. They're on our website too. Just a lot of our folks are savvy on our website. The right-hand side, you just go down and look for Medicare info office. Okay.
Before I move on, I'm gonna switch over to talk about the National Diabetes Prevention Program. And was there any other questions about the diabetes management program before we switch topics?
We have some other questions that were prior. A couple. We can grab onto those here.
If you want to wait to the end,
that's okay. That's okay. What other things are included in a full screening? If a person's blood glucose numbers consistently come back normal, even with several high-risk factors, are there additional screenings that we should try?
No, really the blood levels, the blood sugar screening is the biggest one. I mean, those other risk factors, they may, being physically inactive and having a poor diet, those are risk factors for many health disorders. And so there may be other things that you want to, or other reasons that you want to encourage them to improve on those things, and they may impact diagnosis of other disorders, but I'm focused specifically on diabetes, and so that blood test is really what is gonna be telling on where they stand, if they have normal levels, pre-diabetic levels, or if they're in that diagnosis of diabetes level.
Okay. A couple questions about cooking with lots of salt and fats. Does that increase the risk?
Well, I mean, I think in general that they suggest limiting salt and fat intake. I mean, I can't say for sure somebody that has a high diet or a high salt and fat diet is going to end up with diabetes.
Right.
I mean, you can't make that assumption, but yeah, somebody with that diet, it would be good to encourage them to reduce the intake of those.
All right. Other questions here. A couple questions about exercise. Just, sum them up. How important is exercise? Exercise is kind of hard when people use a wheelchair.
Right.
Or a person uses a wheelchair and they have other conditions that make them unable to move. Basically.
And that's understandable. I mean, some people it is difficult to have physical activity, and something that might be really difficult for one person might be super easy for another person. And so we want to individualize goals specific to the patient's needs and what's realistic for them. So if you have somebody that's bound in a wheelchair, I mean, their goal might be to, I don't know, do arm exercises. I mean, that's something that's an improvement for them. So it's very individual on what the patient's needs and capabilities are.
Mm-hmm. A few of us have commented that we were impressed with the concept of the emotional impact of diabetes, because we work with people and their thought processes and relationships to food quite a bit. So that was interesting to our group. Is there ongoing counseling for emotional support in the evidence-based programs? And what would it look like if that's there?
Yeah, and so each diabetes self-management education and support program may be different, and this is again, this is provided by a healthcare team, And so if they have, you know, actual counselors that can provide that at that healthcare organization, then we would want them to be a part of that team, because the distress part and depression part is something to definitely pay attention to. And that's one of the, I think, highlights of this program is, you know, a patient can go see their provider, and of course the provider is going to say you need to eat better and you need to be more physically active, and that's one of the big differences of this program is, yes, it you know, expands on what the provider says, but they also do have a focus on the emotional support and trying to you know, help the person better manage this and feel like take control, and that alone is gonna help improve the distress and depression of the diagnosed person.
Yeah. Some folks are asking about, some of our audience is asking about people who don't have Medicare, they only have Medicaid. Where would we find out how much this would cost a person if they had to pay outside of the Medicare?
Yeah, I mean, you would have to
call the provider.
Yeah, you would have to call the provider. I mean, they should be following. I believe they would be following the same rates that are set by Medicare for these services, but you'd have to call the provider to.
Yeah, some of them might have another kind of arrangement. Like they may provide it for people who, because everyone who has Medicaid is economic, like they're under economic level. They may have some kind of a sliding scale or something else.
Mm-hmm.
But the list of providers that we had earlier, that would be where to start to find that info.
Yes, and I have heard, I work closely with some of those organizations that were listed, and I have been told by some of them that their higher ups in their organization just kind of write it off. Mm-hmm. Because they realize that this is important, and so I don't want to say everybody's doing that, but
you need to ask.
Yeah,
you need to research it and do your you know.
Yeah.
Okay, keep going. Lots of questions.
Okay.
Lots of comments. Okay. Keep going. Yeah.
So we're going to switch into. So that was all those diabetes self-management. Again, is for people with diabetes, any type, and now I'm switching gears to the program that's available for people with prediabetes. Again, that's 1 in 3 people, and 9 out of 10 of those people don't know they have it. So lots of people are eligible for this program. So the program is the National Diabetes Prevention Program. Again, you have to be 18 or older, have a BMI of 25 or greater, or 23 for Asian Americans, and you have to have a positive screening, and it could be any of those listed there. The CDC prediabetes risk test, that can count as your positive screening and make you eligible for this program, or it can be as from a previous diagnosis of gestational diabetes during pregnancy, or through one of those 3 blood tests. And you are not eligible for this program if you've ever had a diagnosis of type 1 or type 2 diabetes. And so to start off about this program, this is a newer program, and I'm gonna kind of give some background about where it came from. And so between 1996 and 2001, the National Institutes of Health supported this study and the goal of the study was to determine, is metformin, and metformin is a medication available to help people manage the disease. So is metformin more effective than diet and exercise to prevent or delay the onset of type 2 diabetes? And they had a very big pool of people they were studying. It was over 3,000 participants, and they all had impaired glucose tolerance. And the participants came from 27 clinics from around the country. And they took those 3,000 plus participants and randomly split them into 3 different groups: a lifestyle intervention group, a metformin group, and a placebo group. Next slide. And so the metformin group, they received 850 milligrams of metformin twice a day, and that's, again, a common practice that many providers still are using to help people prevent or manage diabetes. And then the placebo group just received a placebo, which is basically a fake drug. They think they're taking a true drug. They received the placebo twice a day, and both of these groups were We're provided standard advice about nutrition and physical activity, you know, something that a provider commonly tells a lot of us when we go to the doctor's office. Next slide. And then the third group was that lifestyle intervention group. And so this group, they had a goal of achieving and maintaining 7% weight loss and participating in 150 minutes of moderate physical activity per week. And this was a goal-based behavior intervention. They, you know, provided by lifestyle coaches. These lifestyle coaches helped participants develop and follow through with goals. The lifestyle coaches, these are trained coaches, and they provided education to participants in nutrition, in physical activity, and how to and behavior modification, and how to maintain those behavior modifications. So in the first 6 months of the program, participants were provided a core curriculum, and they met in group sessions once a week and received this education. And then in the second 6 months, they continued with either one-on-one or group sessions to support the maintenance of these lifestyle interventions that they made in the first 6 months. And so after the study wrapped up, these were the results, and they said that people that were in the lifestyle intervention group had a 58% reduction compared to the placebo of developing type 2 diabetes. And this was more effective than the metformin group, which was only 31% better than the placebo at reducing risk of developing type 2 diabetes. And for people that were, I think, 65 and older, the lifestyle intervention group was at over 70%, showed a over 70% reduction in developing type 2 diabetes. So the results showed it's really effective. Next slide. And so that study took place from 1996 to 2001, and then, of course, government is slow. So in 2010, Congress authorized the CDC to establish the National Diabetes Prevention Program. And what CDC did is they developed national standards for this program. It says you have to follow an approved curriculum. This program has to be facilitated by a trained lifestyle coach, and you have to submit data to the CDC every 6 months to verify that you're achieving these results that they want to see. And the structure of it was very similar to what they did with the lifestyle intervention group in the study. So for the first 6 months, there's group sessions that meet once a week for an hour, and they use a CDC-approved curriculum to teach participants how to make better food choices, how to increase their physical activity, and they also help them develop coping skills and develop realistic goals. And then in the second 6 months, they meet only once a month, and they build on the skills that they developed in those first 6 months to help maintain those positive lifestyle changes. And so there are some in-person national diabetes prevention programs in Alaska. So this is a fairly newer program. You know, they didn't really, Congress authorized CDC to develop it in 2010. I think it took until 2012 to actually get it up and running. And so since then, these are the organizations that have started in-person programs in Alaska, and we've got Anchorage Neighborhood Health Center is just started a new one. We've partnered with them to implement this program, and they actually, I think, started their first class yesterday. And then the YMCA here in Anchorage has one. Tanana Chiefs Conference in Fairbanks has one, and they're actually doing something really cool to try to develop a distance learning method for this, so that they can, you know, get it more accessible to people that aren't in Fairbanks or can't make it in person. And then the UAF Cooperative Extension Service offers this program in Fairbanks, and they're trying to start one in Palmer as well. And then Bartlett Regional in Juneau has a very successful program, and the Kenaisi Indian Community and Ketchikan Indian Communities both offer this program. And so there are barriers. We recognize to participating in an in-person program. You know, first, many people don't know this program exists, so of course they're not going to participate. And a lot of providers don't know this program exists. And the best way to get people to know about these programs is through their providers. So we want to have providers referring, but we need to get the message out there. And then a lack of access. You know, you saw that there was maybe 7 programs in the state, and so there's many communities in the state that don't have access to these programs, and a lack of coverage. The Medicare just started covering this program maybe about a year ago, maybe less than that. But to get Medicare reimbursement, each of the individual programs has to apply to be a Medicare supplier specifically for this program. And you'll notice that there's some of these programs that are offering this are like YMCA and University of Alaska at Fairbanks.
Right.
Those aren't.
How could they be Medicare
Right.
providers?
They're not used to billing and coding, and so it's going to take a little longer for those folks to get on to the Medicare reimbursement. But this is, you know, I mean, Medicare, it's available, and we just need to get more of the programs applying to be Medicare suppliers of it, and getting more coverage outside of Medicare. So we recognize that's definitely a barrier to participation.
Yeah, a couple questions related to that. Do you have to be referred to it from a medical provider, or can you just show up?
Nope, you don't need, it doesn't require a provider referral. If you're 18 and older and you have a BMI of 25 or higher, and you took that 7-question prediabetes risk test, and scored 5 or higher, you can call YMCA and say, hey, I wanna participate. When do you start? So you don't have to have a provider referral and a provider blood test.
Great.
Yeah.
And there may be, again, I think the best answer to how do you pay for it past Medicare is just call the place that you're probably going to engage with.
Yeah.
And see what they do, because they may have, I mean, those places have funding that are even outside my book of knowledge, and they're going to have national grants, and they're going to have all kinds of things that are not part of what we cover and know about here. So you should just ask.
Yes, exactly. Like the YMCA, I know they can potentially offer scholarships for participants that can't, pay for it on their own. And the YMCA also offers a membership when you enroll in the program. And some of them, they may have other, it all depends.
Other things they do.
Right.
Absolutely.
So we are looking at alternative delivery methods, because we know that not everybody can, get transportation to make it somewhere once a week and participate in this program for a whole year, getting to a place. So there are a couple of things that we are working on at the state, and one option is we've partnered with this program called Inquisit Health, and this is free, so anybody can participate if they meet those eligibility requirements. And this is provided, it's not an in-person program, it's provided telephonically, so over the phone, and it's available to any Alaskan. We were originally piloting this on the Kenai Peninsula, but we've recently expanded to all of Alaska. So anybody that's eligible, based on that 18 older, BMI of 25 or higher, and that screening using the risk test or a blood test, any of those are eligible for this program. And participants are paired with a mentor who calls them in the first 6 months. It's about once a week, and then in the second 6 months, about once a month. And they talk one-on-one, and they receive the education and support over the phone. And so this would be an excellent opportunity for the population that you guys serve, because, transportation and just getting out of the house is probably a big issue for a lot of people. And so this, if they have a telephone, they can participate. Yeah. So it's free. This is a partnership that we're working on right now, and there's so many slots, but we have not come close to running out of slots. So that is a non-issue right now. So please feel free to encourage participants or your clients to participate. And how to do that is they would contact Leslie Shellcross. I know it's not the best method, but it works. Leslie Shellcross, she works at UAS, and she's a a full-blown Alaskan, and she's familiar, you know, with Alaska. And she'll talk to the participants, and when they call and tell them about the program and confirm that they're eligible, and then she will hand them off to Inquisit Health, and then they'll be enrolled and can receive this benefit.
Yeah, I'm excited about that part. I think that you're right. A lot of the folks we serve might be able to take advantage of this, and we can probably put this together with the support of certain services to that person. They may have, you know, someone who would help them participate in the phone calls and comply with that part, and then of course support that person with the program goals itself.
Yeah.
And that could be part of a plan of care too.
Yeah. And the mentors, almost all of the mentors are Alaskans as well. So they'll realize that they're not going to be suggesting you go take a 30-minute walk on the beach in December, you know.
Right.
So
that's
important. They're realistic, yes.
Yeah. Great. And having a mentor I'm excited about that idea too.
Yeah.
Great.
So another thing that the state is working on is we're working on developing a partnership with an online National Diabetes Prevention Program provider. And so this is, again, once we get the contract in place, it's going to be free for all Alaskans that are eligible, and those are the same eligibility requirements I've mentioned. And anybody that's eligible can participate online. A bonus is that they'll receive a free wireless smart scale, which I think people sometimes get excited about. And then they get placed in a small group of peers online so that they can have, you know, small group discussions and ask each other questions and support each other through the online platform. And then they'll also participate in weekly interactive lessons, and that's where they'll receive the education. And there are going to be trained coaches available that help provide guidance and support to the participants. And so we've got the telephonic option. People can participate in this program over the phone, and coming soon, we'll also have a free online option for folks. And I hope that it'll be available soon. It's just, you know, contracts are slow sometimes.
Right.
But once it's available, you'll be able to enroll through our website, and it's easy to remember, www.diabetes.alaska.gov. Once this is available, you can visit our website, and you should be able to click a link straight from there to get enrolled.
Mm-hmm. I'm excited about that. I can kind of see the goals that could be supported by our programs in there too, whether it would be focused around residential or just families helping a family member, or community supports. We could probably weave this into a plan pretty easily. And it has a social aspect. Even though it's online, you'll have a small group of peers. And that to me means, you know, like peer, just age like me.
Right,
you know,
right.
You could be younger, you could be older.
Yeah.
So, yeah. So, yeah, I'm excited about that.
Me too.
I'll be keeping an eye out for when that starts.
Yes. And so again, where do you fit in this? Encourage your clients to get screened. 1 out of 3 people has prediabetes, and most of them don't know it. So if they have any of those risk factors or over 45, encourage them to go get screened by their provider. If that's not the best option for them, tell them to take that prediabetes risk test. And then encourage them to participate in this program. You got a brief snippet overview of what this program is about, and half of what you hear or less you're going to remember. So you'll have this presentation to look back on, and you can learn more about the program. There's tons of stuff online about it, and so speak highly of this program and encourage your clients to participate in the program. And then, of course, if you have clients that do participate, check in with them and encourage them to follow through with those goals and sustain those lifestyle changes, and just give them the support that they need. And then here I said you could find out more if you're interested, you're super excited, you can go, here's some links where you can learn more information about both the Diabetes Self-Management Education and Support and the National Diabetes Prevention Program. Those are good links to learn more.
I'll leave that one up for a little bit, and we'll just jump to some questions.
Yeah.
We had earlier someone had written in What about information for minors or children? I would imagine that with the guardian or parent, that any of these could also be implemented, maybe. They want to know, how can we find out about diabetes prevention program or management options for under 18?
Okay, so unfortunately, the National Diabetes Prevention Program, to participate, you do have to be 18 or older. So youth would not be eligible for that program. But if you have a youth that has a high BMI and one or more of those risk factors, the American Diabetes Association does suggest that they get screened if they're 10 years old and has a high BMI and another risk factor, and they can't participate in the National Diabetes Prevention Program, but there may be, I mean, you still would want to catch that early, and they can always try to meet with a registered dietitian or somebody providing medical nutrition therapy. That those options or those services would be available for those underage folks.
Okay. A couple of successful reflections about diet. One of us was supporting a person who increased their vegetarian diet, meaning they had more vegetables in their daily day. Their weight decreased. They use a wheelchair, so they don't move as much for exercise per se, but their change in diet really helped that person.
Yeah, I love hearing those things.
And then other reflections. Education is very important, and having self-discipline, having support for that. It's so hard for people to not overeat, or anybody, even us too, people who are, you know, we're just on the same page with that. People need to have more access to healthy meals. Where can we find lifestyle coaches for our individuals? This will be through the programs that we've been through. There is a comment that says we have had clients go through this program, and it's amazing, but the day hab cap, and that's one of our services that we offer, has caused issues in implementation. You know, that I can definitely understand that. It may be, of course, the story is different for each person, but some of these things could be met with other services as well. So, you know, day hab would be one that would be in the community, or exercise or walking or something like that in the community, but the phone calls and the coaching stuff, that could be at home. So just thoughts. Is there a question? There's a cookbook that has trimmed ethnic dishes to make meals healthier. I saw it in an endocrinologist's office. There might be more out there. There's
lots of different cookbooks and resources out there. But if it was in an endocrinologist's office, I would imagine that it was a good one.
Yeah, it says it's put out through the American Diabetes Association.
Yeah, the American Diabetes Association will kind of give their stamp of approval on some cookbooks, and you might see their logo on the front of cookbooks. That's always a good sign.
Cool. A question says, we might not know the answer. Is the state looking to open the diabetes programs for Medicaid reimbursement? Some of our clients would require face-to-face support due to non-compliance. Not to my knowledge, not with the waiver, but we're in like a tiny corner of Medicaid. So
yeah, I mean, is the question, is Medicaid working towards covering this program? Yeah, that's one of the things that our office would like to work on. But working on coverage is just it takes time, and so we are working on it. It's just baby steps to get there. So I can't say what may or may not come of that. So we realize, yes, that we want Medicaid to cover it.
And as advocates and Alaskan citizens, we can always provide commentary to our legislators about these things at any time. It doesn't have to be when regs are just proposed or whatever. Like when you get a notice, you can definitely contact your legislator. It's very much more, in my experience, legislators do want to hear from their voting constituents. So like as a provider, guardian, or whatever, the voice is good, but if a person who experiences this and they're a registered voter and they talk to their legislator, that just goes so much farther.
Yes,
or communicate in another way. It just doesn't have to be just talk. Okay. Communication between support venues as the daily intake is important. Like if a person, you know, has a time outside the home and they receive a meal and then they come back to the home, and, you know, we'll have to coordinate those things. And then the question says, I've seen sources that cite obesity as being a cause of diabetes in 90% of the cases. Is that true?
Well, when we talk about that BMI, that's a body mass index, and that is depending on what your BMI is, you could be in the obese category. And so that is one of the risk factors for prediabetes and diabetes. And so, I mean, you can't say that's the only thing, because there are people that are super fit and they have diabetes. Yep. So it is a risk factor. It increases the likelihood, but it's not a requirement.
Mm-hmm. Other questions?
These are all great questions.
Yeah. What are your other questions here? We'll give folks a minute or so to type them in. They kind of pop up. I got to the end of the questions there. Don't worry if you couldn't download the presentation with all the. Oh, there was a thank you for sharing the risk factors chart, and one of us said they wanted to make sure they share that with all their people.
Mm-hmm. Yeah.
Yeah.
And I mean, you can encourage all of your clients to take that prediabetes risk test too. There's no harm in that by any means. It only takes a minute.
Yeah.
And you can get a copy of it from the Diabetes Programs website, and we also have all of these programs listed on our website. So if you go to www.diabetes.alaska.gov, you'll find that information there.
Okay. Okay. Is there any information on hypoglycemia, low blood sugar? What's that all about?
So again, I'm not clinical, but so I won't provide an answer to that. But that is one thing that is discussed in I believe both definitely in the diabetes self-management education and support programs. And I would imagine it would be touched on in the diabetes prevention program as well.
The question says, what is the scale of the pre-diabetes when taking the test?
So yeah, if you want to scroll back to it, it's kind of early in.
I'll go back to it.
And we can look at how the scoring is a little more in depth. I know it's kind of small in here, and it's hard to maybe read.
I'm checking this out for myself first. Here's a comment. Since I'm a high-risk factor myself, and I'll bring my clients along. It's just going to take a minute to go back. But hang on, everybody. I got to go back here.
Yeah, I mean, if we're scrolling back so you guys can take the test yourself, that's great.
Sure. There it is, right? That's it,
yep.
Right? Okay.
So how old are you? If you're over 60 or older, you automatically get 3 points right there. Mm-hmm. 50 to 59, you get 2 points. 40 to 49 is 1 point, and then you just write that in the little green box in the middle of the sheet there. If you're a man, you get a point. If you're a woman that's had gestational in the past, you get a point there. If you have a close family member that's had prediabetes or diabetes, you get a point. If you have high blood pressure or ever have, you get a point. Mm-hmm. If you're not physically active, you get a point. And then what is your weight category? And so that's where you look at that table on the right side with your height and weight, and you'd find where you land in there and then see how many points you get for that. So all it takes is a total score of 5, and that means you are at risk and eligible to participate in the National Diabetes Prevention Program. And again, you can access this on the state's website, or if you just Google prediabetes risk test, it should be the first thing that pops up.
Someone says, I'm not happy with my score of 8.
Yeah, I mean, you'd be surprised.
Scoring, though.
Yeah.
Good for
you.
Good
for you.
Know. Yeah, that's okay. Good for trying.
And that would mean that you're eligible to participate in the National Diabetes Prevention Program to help help reduce your risk of developing type 2 diabetes. So you may look into these resources for yourself, not just your client.
Yeah, totally legit.
Yeah, absolutely.
Other questions, thoughts? And it says, when you ever had, does that mean once I had the test of high blood pressure, but the next time it was normal?
Yeah, I guess you would score a point because the question says, have you ever been diagnosed? So yeah, you would get a point for that. I mean, and this is not like super scientific. I mean, it's just, 7 simple questions. So
yeah,
if you don't know how to answer one of them, just take your best guess. And yeah, it's not like,
it's meant to bring you in if you need it. That's
right.
all. It's
exactly.
not meant to diagnose you or
right.
rule you out.
Yes, this doesn't mean you have prediabetes if you score 5 or higher. It just means that yes, you're at increased risk.
It makes awareness and it helps bring you in. Like if this makes you go to a doctor's office and talk about it, then it was good.
Yes.
That's how they make these things.
Yes.
So what are your other thoughts here? Sounds good. People are saying, sounds good.
Good.
I'll freeze on the screen so it stays where it's at. Going to learn about it will at least make you more aware.
Exactly.
And some of us had shared stories of having been pre-diabetic, and one of us had said that she had gestational diabetes. So part of learning that's part of it too.
Yeah.
Interesting.
And we know at the state, we know that awareness is where we really, we do need to focus on awareness. I mean, we want to promote these programs and encourage more organizations to offer these programs, and we're definitely doing that, but we also need to speak to the public and increase awareness of that. And so you might see Facebook posts from DHSS about diabetes, and those were developed by our office. We're going to have radio PSAs airing in November and March. Those are from our office, and then we have digital ads and stuff. So we are working towards increasing awareness, but that's not just by touching the general public. It's like touching folks like you that can help spread the word for us.
Awesome. All right, I'm not seeing many more questions come in. Folks are saying that's good to know, and I'm glad to learn about this. I'm going to share it with my clients, and I'm going to take the test myself.
Great.
And this is giving me good tips. Yeah.
Good. And if any of you, think of questions later on, feel free to shoot me an email or give me a call.
Awesome. And those of us who are here for your CEH, your continuing education hours, I know we're going to end a little early here, but don't worry, you'll still get the certificate that says it's good for 2 hours. It's 2-hour equivalent. I think our brain, our thinking about this is going to extend into the next 40 minutes or whatever. It's okay. I'll definitely be sharing with the individuals on my caseload as well as their families and teams. Thank you.
Awesome. Great. Thank you.
All right. Well, thank you, Mary, for this wonderful information. Folks, you're welcome to click out whenever you're ready. In an hour or two, you should get a certificate that gets pre-made by the GoToWebinar system and goes to your email. If you don't get one or you have troubles opening it, shoot me a quick email and we'll make it happen. Something that your certificate will say 2 hours CEH on it, right up on the top title, so you can use it for your certification packet or recertification packet, renewal or whatever. Anyway, this is Kara, and I want to thank you for participating with us today. I hope you have a great rest of the afternoon, and we'll catch up with you at our next webinar. All right?
Thank you.
Thanks, everybody. We'll hang up now. Goodbye for now.